Greetings, ladies and gentlemen. We just want to take this opportunity to go over bed bathing with you. Okay, so before we start bed bathing, we understand that we must give the patient an opportunity to use the bedpan or the bedside commode before you get started. Okay, so once you do that, you've already explained the procedure to Mr. Smith. He is ready to have his bed bath right now. So I have my basin. I want to make sure I have 2 washcloths. And of course, I have all of my essentials here before I get started. Okay. All right. So now I am going to utilize a bathrobe because I want to make sure that Mr. Smith is covered. Okay. So I'm going to provide a bathrobe, not a bath blanket, a bathrobe. A bath blanket for Mr. Smith to keep him warm. Remember, the patient's room temperature should be between 70 to 73 degrees. Okay, so nobody likes to have a cold bed bath. And then you can remove the gown under here. You always want to maintain modesty. Okay, so you utilize a towel to cover the patient up and only expose what you are working with. Okay. Sorry, so I'm gonna remove the gown under here. All right, so we move the gown. Mr. Smith is covered to maintain modesty. Okay, so the first thing, make sure the bed is at a comfortable working height. I'm gonna raise the head of the bed to Mr. Smith for Fowler's position, which is 40 to 60 degrees. I have my warm water, so I wanna make sure that I have nice warm water, okay, to provide this care. I have my soap, okay? You can fold your cloth in a mitt, okay? Any way you really choose, as long as utilizing a cloth that doesn't splash water everywhere, okay? So you always encourage patient participation. If the patient can help you, allow them to do as much as they possibly can, okay? We always want to promote patient independence, okay? So I'm gonna wring out my washcloth, okay? And I'm starting with the eyes first, or the face first, okay? So I'm gonna cleanse the eyes, working from the inner to the outer canthus. Inner to outer, might be difficult to see, but inner to outer canthus, okay? All right, always cleanse the eyes first. Now, if the patient has a lot of crud around their eyes, you can actually soak a little bit, put the warm cloth over their eye for a few minutes before, so it can loosen up, okay, the crud around their eyes. But remember, it's from the inner to the outer canthus. On the other side, inner to outer canthus. We cleanse, okay? We wring this out, okay? And we keep going. Then we're gonna cleanse the forehead, 1 swipe. And we encourage you not to put soap on the patient's face. It dries out the skin. If the patient has a preference of something they want to put on their face, you can use it, okay? So we're gonna cleanse the other side. Cleanse their chin area. Okay, bring it out. Under the chin, okay, their nose area, and of course, you're gonna cleanse behind the ear, okay? And of course, the neck area, okay? So you cleanse the face, you cleanse the inner to outer canthus of the eye, both eyes, you cleanse the entire face. So once you're done with the face, you can actually pat dry if it's still a little wet from the wash, okay? All right, so now that we're done with that, I'm gonna go down and we're going to cleanse the arms, okay? Because the arms come after the chest. Now you can cleanse it in any way you want to, okay? Any routine. So if you want to do the chest next, that's fine. But we're gonna do the arms next, okay? So you're gonna put a towel under the arm, okay? Each area you cleanse, you are to put a towel under that area. So I'm gonna cleanse the arm first, okay? So I'm gonna rinse it out and I'm gonna cleanse, okay? Long strokes on the arm. Always support the extremity. Long strokes, okay? Long strokes. So it's always wash, rinse, dry, okay? Wash, long strokes, okay? Still washing. I'm gonna go under the axillary area. I'm gonna support the arm and go under the axillary area and cleanse that really well. Warm stroke, long strokes all the way up, okay? If the patient has a lot of dirt in their fingernails, you can always soak their hand here in an emesis basin, okay? All right. but long strokes on the arm. Wash, rinse, and dry. And I'm going to dry their arms with this towel that I'm using, okay? So I don't get water all on the linen, okay? So once I'm done and I dry the underarm area, I can apply a deodorant of the patient's choice or what we have on in-house, okay? But we always assess the axillary area for skin breakdown, irritation, redness. So the best time to assess the patient is when they're naked. So this is the time you start assessing for any abnormalities on the patient's skin. You're also gonna check between the patient's fingers for any skin breakdown, especially if they're diabetic. Okay, so now that I've cleansed the arm, now I'm only gonna do one side. So now I'm gonna cleanse the chest, okay? So remember that we're only exposing what we're working with. So now that I'm working with the chest, I'm gonna cover this area up and pull the blanket down a little bit, okay? So now that we have this area exposed, because it's what we're working with, okay? So I'm gonna cleanse here, okay? And I'm gonna cleanse circular motion, okay? Cleansing circular motion promotes circulation, okay? So I'm cleansing this area here above the chest area, okay? Cover them back up. Wash, rinse, dry, okay? So now that we get to the breast area, so we're gonna cover the chest up, expose just the area that we're working with, the breast area. Now remember, for men, of course, it'll be much easier to cleanse, okay? Circular motion, wash, rinse, dry. When you get to the breast, remember that you are not to palm the breast, you are to lift it with the back of your hand, okay? So you lift up with the back of your hand and cleanse under the breast. So always lift it this way on both sides. So when you look under the breast, you're looking for redness, irritation, or any discharge coming from under the breast. If there's any broken skin, discharge coming from the broken skin, okay? So we always lift the back of the breast with our hand. We never palm it, okay? Wash, rinse, dry. If there's any redness, we can document that. If there's any cream that the doctor ordered, we can apply it under the breast, okay? Or sometimes they'll put powder, okay? All right, so we cover this area back up. All right, and now we're gonna go ahead and cleanse the umbilical area, the stomach area, okay? So I get my washcloth, wring it out, and I'm gonna cleanse in circular motion, okay? I'm gonna also assess the abdominal area for any lesions, any lumps, okay? You can always assess. This is probably a good time if you wanna do bowel sounds. You can actually do it right now, right? Circular motion, wash, rinse, dry, okay? Pat dry, okay? All right, I'm gonna pull this back up because now that I've cleansed the face, I've cleansed the arm, I've cleansed the chest area, the breast area, all right? So now I'm gonna cleanse the leg, okay? So I'm only gonna expose the area of the leg that I am working with. And you're supposed to cleanse one side. You're not supposed to cleanse this side and reach over and cleanse the other side. You're gonna cleanse one side at a time, okay? So I'm gonna apply the towel under the patient's leg here, okay? And same thing with cleansing the legs, long strokes, okay? You're gonna cleanse, okay? You would always assess the feet, any breakdown in between the toes, okay? So you're gonna start here, cleaning from the hip to the knees and from the knees down to the ankles, okay? Long strokes, okay? If the patient has any heat coming from the calf area back here, you never want to massage this area, okay? Because it might be thrombophlebitis and you don't want to dislodge a clot. So you never massage the calf leg, okay? Or the muscle back here, all right? So we are cleansing, long strokes, okay? At the same time, we are assessing. We're never ever to soak the patient's toes, especially if they are diabetic, okay? So we're assessing between the toes here. There's no skin breakdown. We never take the washcloth and shimmy between the patient's toes, especially if they're diabetic, because you can cause skin breakdown, okay? So we assess the toes in between. We dry thoroughly, okay? All right. We've cleansed the toes, the legs. We dry very well all the way down, okay? So now that we're done with the leg, now what you do is you turn the patient over to their back. Now, At this point, you can change your water. You change your water when it's dirty, cold, or sudsy, okay? That's when you change the water. So now I am going to lower the head of the bed a little bit so I can turn Mr. Smith over onto his side, okay? So I'm gonna lower the head of the bed and I'm going to turn him over. I don't want to turn him too much where you can't see him, all right? So when you get ready to turn the patient, you want them to cross their leg over, which makes it easier for you, and you turn them onto their side. Mr. Smith, can you grab the side rail? So whatever they can do to help you, allow them to help you, okay? So the patient is on their side, you have them covered, okay? And you have a towel back here, okay? This is when you cleanse the back is fine, or the back of the neck, but you're gonna change your washcloth when you hit the perineal area. Okay, so I'm gonna cleanse the back of the neck, and I'm gonna cleanse the back. Circular motion. Circular motion is gonna promote circulation. They've been lying on their back all night long, so circular motion, okay? Wash, rinse, and of course, dry the back area. At this time, now we're gonna get a new washcloth because we're gonna cleanse the buttock area. So now we're gonna grab our second washcloth and we're gonna, at this time, assess the sacral area for any skin breakdown, redness, irritation, or any skin breakdown. So I'm gonna cleanse in circular motion, okay? If it's a stage 1, which the skin is not broken in stage 1, we don't wanna disturb that, okay? So wash, rinse, and dry. We turn, and also we can apply lotion to their back once you've cleansed the back area. It will give them a nice massage, effleurage, which is going upward strokes, okay? So that's a wonderful thing to do, is a back massage while you're applying the lotion. All right, so we're done with one side of the bed bath, okay? And then you would go to the other side and repeat, okay? So I just wanted to show you one side of the bed bath. So if you can do this side, you can go and you can do the other side, okay? All right, thank you.